Structure of the first therapy session. Chapter 5. The initial therapy session. Most standard cognitive behavior therapy sessions last for about 45 to 50 minutes, but the first one often takes an hour. These are the important goals: establishing a rapport and trust with patients, and to normalize their difficulties. Socializing patients to the process and structure of the cognitive behavior therapy. Educating patients about the cognitive model and about their disorder. Developing a goal list. Usually start solving a problem important to the patient. Refining the conceptualization, which is collecting additional data to help you come up with the concepts of the client and the specifics of their case. Also, providing hope and some symptoms relief. The initial part of session 1. Set an agenda. First, you would start things off with greeting the client. Then you would ask them, is it all right if we start off by deciding what we're going to talk about today? As well as make a rationale for doing this, in which you could say, we will do this at the beginning of every session so that we make sure that we have time to cover what's most important to you. In most cases, since this is the first session, the client oftentimes won't really have many ideas as to where to start. So the therapist will be the one who initially starts by having a list of things that they would like to go over for that day. For example, the therapist might say, I have a list of things I'd like to go over today, and then I'll ask you what you'd like to add. Is that okay? In clarifying that they will ask what the client would like to add, the therapist is being collaborative. Now, in asking what the client would like to add later on to the session, as the session continues, they might open up and go into something that they feel that they should be doing. For example, they might feel that they should be doing more things instead of the usual things that they do every day. As the therapist would then gently interrupt them and inform them that they are going to add doing more things because this is a setting agenda period of the session. A little gentle interruption helps keep things on track. It is ideally quick and to the point. Making sure you explain the rationale for why you set the agenda is important in making the therapy more understandable to the client. Next, you would do a mood check. And this is where the therapist would ask, how have you been doing this week? After asking Sally for a brief narrative report on her mood and making sure to guide her in just using 1 or 2 sentences for time's sake, I would quickly review the symptoms she filled out just prior to the session. In having the client fill out the checklist before the session starts, it makes it easier to address each feeling because it gives you a guideline in order to keep track of what to focus on. Now for obtaining an update. This is since the evaluation. The therapist will question the client in order to discover any important problems and issues that they have not mentioned yet, that they could take priority in the session. The therapist could ask, what happened between the evaluation and now that's important for me to know? Now, to see if the response is something important, the therapist would then ask, has this been really upsetting you? And, is this something you want me to help with? Although most of the time when getting an update from the client this early on in the treatment, the client only reports the negative experiences. With that in mind, it is crucial for the therapist to ask specifically what kinds of positive things had happened this week as well, because it will help the client see reality more clearly and recognize that because of their depression, they are more prone to focus only on the negative. This then leads to the discussion of therapist diagnosis while incorporating psychoeducation. First, you'd briefly review patients' presenting problems and ask them to bring you up to date. Usually the patient is fishing for just a general understanding of their diagnosis, and with that being said, it is preferred to avoid the label of a personality disorder. Instead, to say something like, it looks as if you've been pretty depressed for the last year, and you've had some long-standing problems with relationships and with work. Now, this is a time when the therapist helps the client change how to see their problems and be more correlated with their disorders instead of their character. By doing this, they evaluate their systems and expressing to them that their depression is in fact a real illness. But with the help of cognitive behavior therapy, many people with the same diagnosis have been able to overcome their depression. After discussing the patient's diagnosis, it is very important to instill hope that actively participating in therapy on the client's part will have a better outcome in therapy. Now for the middle part of session 1, identifying problems and setting goals. To start focusing more specifically now on the client's problems, the therapist will now direct the conversation by saying something along the lines of, now let's review the problems you've been having. This is where it's very important to listen closely to their responses and be empathetic when it's needed. The main goal in identifying the problem is to help the client break them down into more manageable size so that it makes it easier when trying to pinpoint what client's goals are. One of the ways you could do this to ensure that the client is being active in the goal-making process, the therapist could ask if they would like to write them down themselves or if they want the therapist to write them down. Next, it's time to educate the patient about the cognitive model. In this initial therapy, it is very important to make sure that the client has a clear understanding of how their thinking affects their reactions, preferably using their own examples. For instance, the therapist could say, "Can we talk for a few minutes about how your thinking affects your mood? Can you think of any time in the past few days when you noticed your mood change? When were you aware that you had become particularly upset?" This will help them realize that the theory is focused on the relationship among trigger situations, automatic thoughts, or images and reactions. Next, the therapist will work on trying to make the experience more vivid in the client's mind, because this will reinforce the cognitive model. Here is when it gets really important for the client to have a full understanding of their feelings and keep track of them so that the therapy is more successful. Next, you discuss a problem. If there's a time, if there is limited time, the therapist might start discussing a specific problem that could be very significant to the patient and develop alternate ways of viewing the problem, or talk about the concrete steps that they can take to solve the problem. This tends to lead to increase their hopefulness that treatment will be effective. End of session 1. Providing or obtain a summary. At this point of the session, the therapist is guiding the discussion to a close and is beginning to tie all the threads of the session together and reinforce the important things that are covered. The therapist might ask, "Can you tell me what you think is more important to you to remember to this week?" This will helpfully engage the client in remembering the importance it will be for them to follow through with their homework. This is the time of the session in which there is a review of the session as well as a review and reminder of the homework that the client has agreed to do. Next, you review homework assignments. A significant part when wrapping up the session is going over the homework assignment. It is crucial that the therapist really tries to maximize the chance that the client will actually go through and do the homework. In doing this, they will often help get a plan of when they will fit the homework into their day. They might even suggest that they set alarms or put notes in places that they are more likely to see them. Going over the homework could also be a chance in which the client and therapist can make any changes that will increase the outcome and success of the homework. In most cases, when dealing with depressed clients, they can easily become overwhelmed and then self-critical if they do not complete their homework. So how this part of the session is conducted becomes very important in terms of how will this affect the client, what is the goals of this assignment, and will this assignment be helpful for this particular client. Elicit feedback. By the end of the first session, most patients feel positively about the therapist and the therapy, but it's also a part of the session in which the client gets a chance to express and you to resolve any misunderstandings that they might have. In conclusion, the overview. Developing a solid therapeutic alliance and encouraging patients to join with you to accomplish therapeutic goals are of primary importance of the session. The first session is the most important and often the most difficult because of the therapist must address several areas. Begin to establish a relationship with the patient. Assess the nature of the patient's substance use and other problems that may be important factors in treatment. Provide a rationale for the treatment. Establish the structure for the remaining sessions. Initiate skills training. Why is this important? In this session, you will briefly explain the current problems and outline your expectations. That forms the basis for discussing the goals of therapy and the therapy plan. Cognitive behavior therapy requires the patient's commitment and own initiative. The therapy can only be successful if the patient actively takes part in the treatment and also works on their problems between sessions.